So today we will talk about the examination of the thyroid gland. So the steps involved in the thyroid examination are inspection, palpation, percussion, and auscultation. Before starting the examination, first of all, you should introduce yourself to the patient, take informed consent from the patient, explain all the steps of examination to the patient, and expose the patient neck and proper positioning as the sitting position. So the first step in the thyroid examination is inspection. An inspection asks the patient to slightly extend his head so that the neck become prominent and look at the patient neck and note for the skin changes like any scar mark, pigmentation and any sign of inflammation on the neck, and also note any dilated veins. Similarly, also look for any visible lump, and if a lump is present, note its size and shape of the lump, and also ask the patient to swallow the saliva and look for the movement of the lump with the swallowing, because the thyroid swelling they move with the swallowing. Similarly, ask the patient to protrude his tongue. If the swelling moves with the tongue protrusion, it is thyroglossal cyst, because the thyroglossal cyst it moves with the tongue protrusion. So the second step in the thyroid examination is palpation. First of all, warm up your hand and we do the palpation from the front side and also from the back side. From the front side, first of all, check the temperature of the neck with the back of your hand, then superficially palpate the neck on both sides, and superficial palpation, we look for any tenderness while looking at the face of the patient. Similarly, also locate the trachea from the front side and note by any tracheal deviation. Then there is a method known as the Quail's method. In Quail's method, we ask the patient to swallow and we peel the swelling with the thumb to look for any nodularity. Then from the back side, we ask the patient to slightly flex his neck and push the gland from one side with one hand and deeply palpate the other lobe, and repeat it for the other side as well. So this method of palpating the thyroid from the back side is known as the Lahey's method. And also check the carotid pulse on one side and then on the other side separately, and never check the carotid pulsation on both sides simultaneously. And similarly, also palpate the lymph nodes of the head and neck areas. And if there is any visible swelling or lump in the neck, then check the size of the lump, both the lengthwise and widthwise. Also measure the shape of the lump, whether it is globular or rounded in shape. Also palpate the margin of the lump, whether it is regular or irregular, and also look for the consistency of the lump, whether it is cystic or hard, and also perform the skin pinch test, which indicates either the swelling is attached to underlying skin or not, and also check the mobility of the lump, whether the lump is mobile or it is fixed. Similarly, we also do the percussion from the second intercostal space upward towards the neck on both the side, and if the percussion node is dull, it indicates the retrosternal extension of the thyroid gland. Similarly, we also auscultate over the lobe with the stethoscope to look for any vascular buoy. Similarly, also check certain specific signs in the thyroid diseases. The first one is the Berry sign. In Berry sign, there is absence of the carotid pulse. Second is the Pemberton sign. In Pemberton sign, we ask the patient to raise his hand upward. On raising his hand, there is facial flushing occur due to venous congestion, which indicate the retrosternal extension of the thyroid gland. Then there is Mobius sign. In Mobius sign, we do the convergent eye test, and on convergent eye test, there will be a diplopia to the patient. Then we have the Von Grappi sign. Von Grappi sign is the lead leg sign, in which the upper eyelid they do not follow the movement of the eyeball. And then there is a Jeffrey sign. And Jeffrey sign, there is absence of wrinkles on the forehead and looking upward. Then we have the Stellbeck sign. In Stellbeck sign, there is incomplete blinking of the eye, which leads to the corneal dryness and the ulceration. Then there is Hostogi sign, in which there is loss of hairs on the lateral third of the eyebrow. Then there is the limpal sign, and the limpal sign, the eye become prominent on upper lid retraction. Then there is Cocker sign. In Cocker sign, we do the gentle compression of the lateral lobe of the thyroid gland, which produces stridor. Then there is Nebzager sign. In Nebzager sign, look from the top and note whether the cornea or the eyeball is visible or not. If the eyeball is visible or prominent, it indicates the exophthalmos. Then we also do the general physical examination. First, check the palms of the hand for sweating. And if there is sweating, it indicates the hyperthyroidism. Also, check the radial pulse. Then check the blood pressure and also examine the lymph nodes in the head and neck area. And the lymph nodes region involve submental, submandibular, pre-auricular, post-auricular, and the cervical lymph node. Also tape with spinal bone for pain, and if there is bone pain on taping, it indicates the metastasis to the bone. Then we also check certain specific signs that occur in the hypothyroidism and the hyperthyroidism. In hypothyroidism, check the reflexes because the reflexes will be delayed. Similarly, also check the ascites, which is done to the fluid trail and shifting dullness. And also there will be weight gain occur in the hypothyroidism. And also note the mixed edema around the orbit. Similarly, also check for the signs of hyperthyroidism that include peritoneal edema and the weight loss. At the end, call the patient and say thanks to the patient. So it was all about the examination of the thyroid gland.